EAF Festival 2023. My name is Tomiwa Adaramola. I am one of the volunteers of Engage Africa Foundation. Engage Africa Foundation is a volunteer-run advocacy platform that focuses on raising awareness about non-communicable diseases across Africa. Our mission is to inspire action that would foster change that would down the road reduce the incidence and prevalence of non-communicable diseases, thereby increasing the health and well-being of every African. A little bit of background information about me. Again, my name is Tomiwa Adaramola. I am currently a registered nurse in Edmonton, Alberta. My main area of practice is in the operating room. I also have some experience in mental health and in geriatrics. I'm going to talk about mental health. First, I will talk about types of mental health disorders. Then I will follow by talking about the management and treatment of mental health disorders. And finally, I'll talk about the perception associated with mental health disorders, mainly in Africa. Types of psychological disorders includes, but are not limited to, anxiety disorder, obsessive compulsive disorder, trauma-related disorder, bipolar disorder, depressive disorder, schizophrenia spectrum disorder, dissociative disorder, and personality disorder. Obsessive compulsive related disorders involves at least one pronounced repetitive behavior that exceeds societal norms and usually involves a ritual. Obsessive compulsive disorders, the person has an obsession or a compulsion, or they have both. Now, obsessions are repeated, intrusive, and uncontrollable thoughts or impulses that causes distress or anxiety to the person involved. Now, the person is aware and typically responds to them through a compulsive behavior. Now, compulsions are repeated physical or mental behaviors that are performed in response to an obsession or in accordance to a set strict rules that they have to follow in order to reduce the amount of stress that they are experiencing at that time.
Who do we love?
Penny.
Who do we love?
Penny.
Who do we love?
Penny.
Trauma-related disorders includes disorders such as post-traumatic stress disorder, also known as PTSD, acute stress disorder, and adjustment disorder. Now, PTSD, post-traumatic stress disorder, can occur when someone feels intense fear, horror, or helplessness after experiencing or witnessing extremely traumatic events. This is seen usually amongst soldiers or someone who has experienced a violent experience, like possibly traumatic, like a sexual experience or a traumatic accident. Traumatic events could be relived vividly through dreams and flashbacks in which the person feels as though the event is currently happening to them in real time, but which it is not. Now, acute stress disorder is somewhat similar to PTSD, but the symptoms are milder and they last for about 3 days and shorter than PTSD. Adjustment disorder involves the inability to adjust properly to new situations, such as a romantic breakup or having a new job that you're not able to cope with, or marital issues. Depressive disorders are common psychological disorders that involves depressed mood or loss of pleasure or interest in activity that individuals were previously very much interested in. Depression can happen to anyone, and people who have lived through abuse, severe loss, traumatic events are very likely to fall into depression. women are more likely than men to fall into depression. And depression is different from a regular mood change or a feeling, what you go through in everyday life that stresses you. This is because a major depressive disorder can affect all aspects of an individual's life. When I say all aspects, yeah, like I mean stuff like relationships, your work, your mental health. Usually, that really goes down the drain with major depressive disorder. And this is because it is a consistent pattern of abnormal and painful mood symptoms, which is severe enough to cause significant personal distress. Typical examples of major depressive disorders or major depressive episodes includes deep feelings of sadness, tearfulness, emptiness, or even hopelessness, angry outbursts, irritability, being really frustrated with everything, loss of pleasure in things you usually like, loss of interest in everything and in anything, such as sports, your hobbies, sex, and a very significant aspect of symptoms in depression involves insomnia. When you realize that you're not able to sleep or get REM sleep to recover from the daily stresses, then there's a good chance that that individual is experiencing major depressive disorder. Treatment of major depressive disorders involves medication as prescribed by your physician, psychiatrist, or psychologist. And another important aspect of treatment is counseling in the form of psychotherapy. In order to know what medication works best for your condition, it is best to actually have a conversation with a psychiatrist or a physician. However, if you know anyone who is depressed and they verbalize at times of they verbalize the desire to hurt themselves, or if any of that kind of thing is observed in them, it is best to keep an eye on them, monitor them, observe them, always be around them, and try to get as much help as possible for that person. Before I start talking about the perception of mental health in Africa, I'm first going to give some statistics regarding the current condition of mental health and mental health disorders in some African countries. For instance, in Nigeria, only 1% of people with mental health disorders actually receive specialist treatment. There are about 300 psychiatrists, 2,000 psychiatric nurses, and 400 specialists to care for a population of over 160 million people. In Kenya, there are about 500 mental health care specialists to care for a population of over 50 million people. In other countries like South Africa, only 27% of the residents of or citizens of South Africa actually have access to mental health care in the event of for those that have mental health disorders. So initially, it is established that there's an issue with access to care because there is reduced human resources and the people that know how to care for individuals with mental health problem. Now there's that. Another issue in Africa concerning mental health care is the stigma associated with receiving mental health care. Um, in Africa, I know for sure, in a country like Nigeria, the typical the picture, the image of a person with mental health disorder or mental health problem looks like someone that is running or walking on the road on the highway half naked, probably entirely naked, looks poor, looks has a bad bad outlook about him or her looks very unkept, pretty much, and nobody wants to be associated with that kind of image when going to a clinic to see a psychiatrist or a psychologist. Unfortunately, in Africa, it is widely thought that if you have a mental health problem, you'll probably end up on the road, on the highway. It's just unfortunate that there's a stigma attached to receiving mental health care, or to even, and you don't have to declare, but if it is established and identified that, oh, this person has a mental health problem, then unfortunately that person might be tagged as someone that is going to be, walking on the highway. It encompasses both emotional and psychological well-being, and it is very vital for the overall quality of life and functioning of an individual. It is important to note that mental health can vary over time and across different life stages. In other words, it can be the difference can be generational, the difference can be genetics. What is affecting your mental health can be different from what is affecting the mental health of your parents or the mental health of your kids. Your genetics can predispose you to either good mental health conditions or very bad mental health conditions, which is why it is good to maintain a very holistic approach when considering your mental health care. Now, when it comes to mental health management, it is crucial and very important to remember that a person's mental health experience will be very different from what another person would experience, like in terms of mental health care. So in other words, what works for someone may not work for you, or it will not work for you, because everyone is just so different. It is very important that you seek help from a trained and qualified mental health professional and try to come up with a treatment plan that is tailored exactly towards your own particular needs. Your mental health is connected to your emotional well being, your physical health, your productivity and functioning at work or at home or another aspect of your life. Your mental health is very connected to your ability to establish and maintain interpersonal relationships. Your mental health, is able to help you cope with life challenges. And most importantly, your mental health is very connected to your self esteem and your self worth, which is why it is very important to focus on your mental health as much as you're focusing on your physical health. Promoting mental health care involves creating a supportive environment for people who have mental health issues, reducing stigma associated with mental health, and increasing access to mental health care, mental health services. Overall, mental health is essential for living a fulfilling and meaningful life. And taking care of your mental health is a vital aspect of maintaining overall health and happiness. Taking yourself out of a stressful situation may not be enough for mental health care. It's good practice. However, knowing when to seek help and actually seeking help for mental health care professionals is very important, so that they can come up with a treatment plan that is tailored towards your own specific needs. Thank you for taking the time listening to me, and I hope my message on mental health do resonate with you. And also, you should know that you are the most important person when it comes to taking care of your mental health. Enjoy the rest of the festival.